Okay, welcome. We're honored here to have Donna Chow talk to us a little bit about microcurrent. She's got a great background. She's worked with physical therapists, massage therapy. She's actually worked in schools and opened up many schools to carry the facial spa. So microcurrent and devices are her gig. So this is the gal. So Donna, why don't you tell us just a little bit of background about you, and then a little bit about microcurrent and how it can relate to what Shannon and Ashley are actually doing right now.
Okay. And I have been in the medical and the spa industry probably for over 35 years, maybe. My background is in as a physical therapist, massage therapist. I'm an educator, a massage therapist educator as well. I've been an instructor for cosmetologists and estheticians. I taught facial massage there. I've implemented microcurrent into the curriculums at these schools with our technology and our devices. And I came involved with New Skin. I met Kelly and Joyce at a event, and I fell in love with the nutritional side of things and our medical technology that we have. And I started implementing that into a lot of healthcare professional practices. And then when the facial spa came out, I really grabbed onto that and took that to a whole nother level and included it into the curriculums at the cosmetology and aesthetic schools. And then it became part of all the student kits in like over 30 plus schools. And that's kind of where my background was.
Awesome.
And so just to give you a little bit about microcurrent, microcurrent has a lot of cosmetic benefits, but also has a lot of therapeutic benefits. And a lot of people don't realize the benefits that it has. And microcurrent works with our natural body's energy. So it's and our device is very non-invasive, which is so cool. We don't have all the wires, we don't have all the probes, we don't have to worry about burning someone. It's going to actually match that person's already natural electrical activity. And is an example, like when somebody has an injury, electrical signals like naturally occurring in our body would go through the injury, okay, or no, actually go around the injury, where our microcurrent sends that current through the injury, so it increases that repair much faster. And it was used, microcurrent was used over 200 years ago. It was used in different medical applications, from bone healing to needleless acupuncture to Bell's palsy and strokes. And that's where I got involved. I got involved working with my physical therapist and my doctors that I was working with, my chiropractors, and we would have people coming into us that had strokes and they couldn't. And with Bell's palsy, you can't talk, you can't drink, out of a straw, you can't close your eyes. And when they would come out of a therapy session with me after one treatment, they could drink out of a straw, they could close their eyes. And the doctors were just baffled. They were just baffled, and then they started sending everybody to me. And that's where I really learned what this thing could do. And I really just moved with it. And I can implement this technology into any healthcare profession, dental, vision, chiropractic, physical therapy. And microcurrent can be used in so many different modalities. It's like endless. So it's really exciting. But that's where my background came from. And cosmetic benefits of microcurrent is tissue, it increases circulation, it helps with connective tissue, with elastin, with collagen. It helps increase the ATP by up to 80% after a treatment. And ATP, that's our energy of life, that's our energy of ourselves. Can you imagine what we can do at 80% after a treatment, increasing that cell turnover? Do you know what your products are going to do after you kind of know what your products do and how long it takes for a response, correct? Mm-hmm. Right? Well, if we can increase that cell turnover, we can increase that product penetration, your clients are going to see more results faster. Which what does that mean? It means they're going to want to do more. instead of going, putting it in a drawer and not using it again, right? So
Right.
that's what really becomes fascinating, is when they can see these things happening and you can see these things happening. There are studies out there, 200% university, I think it's 200% University of Washington School of Medicine showed a study that there's a 14% increase in collagen production, 48% in elastin, and 39% in blood circulation, on top of 80% increase in ATP. And the reason I'm pointing those numbers out is because that's your alley, that's your industry.
Right.
Okay. Now, it also helps with increasing muscle re-education. It brings that muscle memory back. People are going to ask you, how long does this last? It's going to be accumulative. So if I did a treatment on someone, they're not going to look the same tomorrow and the next day and the next day. I mean, they're not going to go back to what they look like that the day before. It's going to stay there. But every time you do that treatment, it will rebuild on that improvement. Now, if you don't do it again, obviously after days or a week, it's going to go back. Aging sets in again. Okay. But we can reverse those wrinkles. We can reverse that damage. And that's really something to really point out to someone, is they're not wasting their money. They're going to see those changes, and you could just see it in Joyce's skin. She's beautiful, and Colleen and Dylan. I mean, everybody is just vibrant from being able to use it all the time. And I have pictures, but we're not sharing the screen, or I could show you some pictures, but we can always show you those later. We can go back and look at some pictures. But you'll be amazed at just the difference in 15 minutes. Like you were saying, how somebody's skin just goes, It also has a lot of key benefits for inflammation. So when you're dealing with people with rosacea and acne, you're going to see major changes, because what does that all do to? Inflammation. We can get rid of inflammation, we reduce those things in the skin. Okay. The complementary alternative benefits to microcurrent are, and I have my slideshow here just to keep me on track, so I make sure I give you guys all the interesting things. Improvement in cellular metabolism. It relaxes sensory nerves, joints, muscles, tendons, stimulates circulation, decreases inflammation, restores muscle tone, reduces acute pain, range of motion, I don't know if I said that, and soft tissue regeneration. So those are a lot of the things that it does. Now, if you go ahead and Google different things that people have, and you put microcurrent, or as our device is classified as a transcutaneous electrical nerve stimulation, you look those things up and you put it in the search bar for what your clients have, you're going to see all these studies come up. You can just point people to those things to look at, because it's not just what you're telling them, it's already documented. Okay. So it's good to be able, and when I go and try to train doctors and spas and estheticians, I always use the studies that are already out there, because this is going to sell them in their profession. This what they can relate to. That's just a little tip. And I have lots of studies for all these different things. Now, one thing I learned, and I showed my estheticians when I was teaching, was I'm not sure if you're familiar with thermography. But thermography it shows inflammation under the skin. They use it instead of going for a mammogram. It's like non-invasive. You can see where inflammation is in the body. It kind of is. It's something they use as a picture of may somebody have an issue, right? Other doctors, it was mainly used more for mammograms, like for women, but they started using that for other areas of the body, for other professions, because when you see that inflammation, you kind of know what's going on. I have pictures I can show you later as well. I had a student that I did a thermography session on, 15 minutes before the microcurrent, 15 minutes after the microcurrent. This is with the facial one. And you can see where the TMJ was. And she had a dental appointment right after class. That inflammation decreased within that 15-minute treatment. That's why I was saying with the pictures that you can show them with the app, you can show people what's happening in their skin before and after. We can't show the inflammation, but we can show the differences in the texture, the tone, the pores, the lines, the wrinkles, those things. Now with the new wellness spa, and you guys are wanting to know about that, correct? All right. So with the wellness spa, it has all the benefits we already had with microcurrent, everything we just talked about, but we're relating it now to the body. Okay. So we have all those things we talked about when you're thinking about skin for the face, but we also have all those things cosmetically for the body, veins, cellulite, contouring, all of those things. And then you have your therapeutic side of things, your pain, your injuries, your muscle, working out, lactic acid, all of those things. So you're just relating that same technology in regard to those things in the body. The one thing that's really great about our new body spa is it has everything we already had that was wonderful and all the amazing results we were seeing already. But now we can target not only cosmetic, but therapeutic at the same time, based on the different formulations we're using with it. So the ingredients that we're giving to the skin, and we're changing the current without the wires and the probes, which is what I love. We're able to do the same thing. Now, the neuromuscular stimulator is a TENS unit. It's meant for pain. If you look at the FDA classification from the Renew Spa, and I have those papers, these are good for you to have too. It actually shows you that it's actually, let me bring it up here and just read what it says real quick. The classification, because it's important, because when you go and look at all the clinicals and you're talking to people, now you can't make medical claims, but I'm wanting you to know for yourself, okay? That, and again, if you're going to say anything about what it does therapeutically, you refer to what's already out there. And you can show them the FDA paperwork. And the FDA paperwork, it specifies it's a transcutaneous electrical nerve stimulator for pain relief. That is in the FDA paperwork for our Renew Spa. So even though we are not putting it out there that way, that's what it is. So that's pretty cool, right? Okay. So
that's good for the doctor to know, because the doctor can probably say that.
yes. And here's the other thing. When I've called our product support and I've asked them that specific question, I say, okay, if you're trained in microcurrent, which you guys are, you've been trained in it, okay? If you've been trained in microcurrent, if you have a license as a doctor professionally to use microcurrent, can you use it therapeutically? And they said yes, as long as that's, because we're selling it to the normal person, we're not doing that. But if we're selling it to a professional, they can use it that way if they're licensed to do it. You can easily get a microcurrent training and certification and use it the way you want to. If you're going to bring a doctor on board, like a pain clinic to work with you, or you can give them these things. There's even ways we can bill it out with CPT codes. There are CPT codes for electrical stimulation and TENS and microcurrent. So these are good for you to know for doctors. That's how I built my business. I'm hoping you guys, I'm making sure that you guys can't see my presentation. I'm trying to just not get it in the way of anything here. So with the lymphatic system, the new body spa, okay, so we have all that about the therapeutic side. I'm trying to keep on train of thought here. It focuses more on the lymphatic system. Okay. And when you think of a TENS unit, if you're familiar with that, those are little electrodes they put on people. Even in the FDA classification, it talks about electrodes. So our device is still using electrodes. We're just not patching them on people. And we're not setting the devices to people's skin. It's setting itself to that client. So it knows the right setting. And based on whether you're using it cosmetically or you're using it for muscle stimulation, however you're setting that machine and the solutions that you're putting on, that's how it's going to target the skin. Does that make sense? Yes. And it works with that lymphatic system. And I'm not going to go into a lot of stuff about that. I just wanted you to know. Now, with the lymphatic system, are you familiar with the lymphatic system? The facial lymphatic system, it works. I always tell people, if you do this around your nose, anything in this triangle is going to come down. Anything outside of this triangle for the lymphatic system when you're doing your strokes, anything outside is going to go this way and down into the clavicle. That's your drain. The body, I think it's the right side, everything drains down to the thoracic. Everything on the left side comes up to the hip. Okay, so it doesn't even go. So when you're working the body and you're using this lymphatic, you're using the device, you want to follow that lymphatic system. So, you know, if you're working the legs, you're going in an upward direction. Everything's up for lymphatic.
Right.
If you're contouring, it doesn't really matter. You can just work the muscle and just follow the muscles up and around, okay, where they insert and attach. But lymphatic, for the therapeutic side, you always want to follow the direction the lymphatic system goes. If you're using the facial spa, just remember that imaginary triangle and how you're working that facial spot. And then you're also using it where you're following the muscles. So your attachment, like under the jaw for the jowls, is up behind the ear and then in front of the ear. So it's the lift and the hold. Okay. Those techniques, if you really start to think about your muscles and your lymphatic system, you are going to, it's like you're an artist. Like when I work on people, ask Joyce, it's like, I feel like I'm painting. And you can just literally see the wrinkles and everything disappear, right, Joyce?
That's
Because
right.
you're following those muscles and you're really concentrating on those attacks. And you guys can do that. Now, your client, you don't have to give them that much direction because they're coming to you as a professional. For you, sending it home with them, they're using it to drive that product in and to enhance the benefits that you've already given them. So you're using it in conjunction to enhance what you're already doing with them, what you're sending them home with, whether it's our products along with some of your products. It's going to enhance those benefits. Okay.
Donna, can we take just a little break now and see if there's any questions that the girls have up to this point?
And I'm hoping I'm not overwhelming you.
I don't think so, because between them and between the trainings, Nu Skin has some pretty good trainings, and Colleen and her team do some great trainings on Saturday. We're certainly all kind of familiar with that. But
yeah, and I pretty much, that's all I really had to say. I just wanted to get that out there and, and then kind of go through the strategies and what you.
I don't think we can hear about microcurrent and what microcurrent is and what it does enough. So I think that's really important, Donna. That was
and I don't
great
think
overview.
I understand that as much either,
So Shannon and Ashley, do you have questions? This is a great time to ask Donna.
Well, I definitely love the review because it has been like 14 years since I've been in school. So I do appreciate that. And I have a question, but I'm having a senior moment. So I have a little tiny distraction back here.
A little cute bunny rabbit, it looks like, or something back there.
He's Grogu. It's like a Star Wars character.
Oh, well, he's cute as a button.
Thank you.
Ashley, what are your thoughts? How are you going to be introducing this when you're in the school?
I would get with the main teacher. Well, actually, sorry, I lost my train of thought. I emailed the chairman of the barbering and cosmetic arts, and she kind of like passes or declines like the buying of it. So I'm trying to get these two products into the clinic of the aesthetics department. And I mean, she seems interested for what I can tell. So she's just reviewing it, and I would love to just
A suggestion.
yes,
Incorporating this into the segment where they teach microcurrent.
Okay.
So basically, it's using all the existing theory for microcurrent.
Right.
Instead of using the microcurrents you have now.
Right.
This would be I got it into my very, very first school that I brought it into was the Southwest Institute of Natural Healing in Arizona. And we taught old school, new school.
Okay.
So we kind of incorporated into the curriculum where when it got to the curriculum, to that point of the curriculum, when they were introducing microcurrent, they would introduce the facial spa. And it would be the non-invasive. What is really good about it, they would show them how they can use this as a tool when they graduate, because that's how I got it into the student kits.
Okay.
It was a tool that they could have right away. It's very expensive to buy equipment.
Right. Yes.
And it's also very hard when you're just starting out and you don't really have a place to go and you may want to drive people to you. To
Right.
have this device to drive people to your new practice, to have a device that you don't have to spend a lot of money on right away.
Mm-hmm.
It could be very mobile as well. And in school, it takes away a lot of liability
Okay.
because you can hurt somebody with the
The
other.
other ones. Right. So is that how I would say, okay, if they ask me, why should I buy this when we already have microcurrent?
You put your pros and cons together. You
Okay,
put
yeah.
the benefits of what we have against what they have.
Okay.
And you show the FDA paperwork that it's exactly the same thing.
Right.
It's approved. And then you show them the financial aspect of what they can gain by, if the school signs up and they buy it through you in the school, they're going to have commission or residual. And it
Okay.
fits right into the curriculum because it is a microcurrent.
Right. Correct. Yeah.
Do they have kits, Ashley, at your school? Do the students get a kit?
That yes, they do.
They all do. Mhm.
Yes.
Yeah.
Yeah.
They don't have to put it into the student kit, but
Right.
it makes sense to factor it into the cost.
Right.
They could do it that way, or they could just introduce it, some schools I would just go in and do it as an outside class
Mm-hmm.
or the industry class, and then if the student spot, then they got excited that way. But I did have a big chain of schools where they actually wrote it into the curriculum.
Okay.
So where it came up at a certain point in that curriculum, and that's when we would teach it.
Okay. I do have a question, not about the schooling, but about the device itself.
Mhm.
So, I was telling Shannon and Delynn about my mom's knees. It may have to do with the bones, her knee itself. So, with that working the muscles around the knee, would that help it?
It's first off, that it would reduce any inflammation for the injury.
Okay. Okay.
It's going to help the cellular turnover and the repair,
Okay.
and it reduces the pain.
Right.
It helps to bring muscle memory back. The one thing that I used to do, I don't know, did her doctor give her exercises to do? What I used to do in therapy, I'm just going to give you an example. And, if somebody had an injury in their arm,
Mm-hmm.
I would have them do exercises.
Right.
And as they're doing the exercises, I'm working the muscle with the machine,
Okay.
bringing that muscle memory back.
Okay. They
What about
probably did, but
collagen?
she doesn't
What
do
about
it.
collagen with it for something like that?
Yeah. But the collagen, obviously for the body, but it's going to be more for the face. With the facial spa, you're going to see a lot more with that.
But enough for the knee, like
Yeah. It's going to, because remember I showed you that study. If you pull up the study with the increase in collagen, elastin, and cell turnover after a microcurrent, there's a major study out there, and I could look it up and send it to Joyce and give it to you guys.
Colleen's husband had incredible results with his knee surgery using
Okay.
your new spot. Wasn't that correct, Colleen?
well, we didn't have the Renee Spa then. He used the collagen, and the collagen, like some doctors
Oh.
even recommend that because the collagen really helps with wound healing and all that repair, and it helps it to rebuild all those things a lot more quickly.
And it's going to increase the benefits of the collagen you're taking too, because it
Right.
has circulation.
Exactly, because it's internally helping you produce. You're
Mhm.
getting inside outside.
Yeah. I had an injury where I had surgery on my elbow, and I went back to the doctors and he couldn't find the incision. And he was like, "Where did I do the surgery?" Because it was too fast of a healing,
That's
He was
great.
looking decision, you know, is funny because it does. It's amazing how much it heals.
Yes.
Shannon, did you get over your senior moment?
Yes, I did. He went in the other room.
Oh, oh, I thought it was a senior moment because it was a question you had.
I have two questions actually, and this little chat kind of jogged my memory. So first question is, since this is a consumer device that's widely available to consumers, we estheticians will not need extra training, correct? Like, because I know that to like in Washington and in Iowa, we would need, in order to do advanced technical stuff, we would need additional training.
Check. Okay, I know what you're asking. Okay, there could be two sides to it. Number one, I know that there are some states where, like, you know, you have to be certified in a certain thing to actually do it as a treatment. But it is a non-invasive device.
Yeah.
It is meant for the consumer. So if you are, see, I'm a massage therapist, and I would incorporate it in with my massage, but I would add it on as like a facial sculpting type thing in my practice, and I kind of use it along with my massage. You know, I did my hands and I did the machine at the same time. Like, I mean, it's a non-invasive device. You should be fine. But
Yeah.
just check with your state, because like giving it to them and showing them how to use it, or giving them a demo, and then maybe have them, you know, but I know you want to put it into your treatment. So just find out if it's a non-invasive device that's a consumer can use, if you can incorporate it in as a modality.
It was cleared by the FDA as an in-home
Yes.
Yeah.
So
device,
just,
so
yeah, I mean, so I think you're fine, but you could always reach out and have them, you know, if you're not sure. But I
Okay.
think it should be fine, you know, because
Okay.
like I said, you do have that classification. It is meant, but you know, I know that like if you're not trained, sometimes a certain thing, like from, you know, you may have to do it under somebody else's license or those,
Yeah.
those kinds of
Like have a
so,
medical director or something.
yeah, yeah. So just
Another question I had, and I was asking Delynn if she thought that this would help, but my husband has had vertigo for over 20 years, and we've tried everything under the sun to try to like get a handle on it. We've gone to ear, nose, and throat doctors, ERs.
I'm looking for you. So go ahead.
You bet. And so I was wondering if because he went to a stomach doctor or a GI doctor, and he says he thought it was the vagus nerve that was being tripped off and causing the vertigo. And so I was wondering if the Renew Spa would help.
Okay. Frequency specific microcurrent is a type of microcurrent therapy that may help with vertigo and other symptoms with vestibular symptoms, problems such as dizziness and balance issues, works with increasing production of ATP and energy. That's how you answer your questions. It's
Okay.
like, so, and
Would that be using it anywhere on your body, Donna?
mhm.
Okay,
Yeah,
because
so
and
you
part of
use-
part of that
obviously, like,
is
yeah,
it with,
huh? Go ahead. Go ahead.
it's when you're moving lymphatic, that's affecting the vagus nerve too, right?
Yes. Yeah. Like even when you go for a surgery, any cut anywhere, that is involved. So yeah, totally.
Okay, that's awesome.
And
That's
I needed to look it up because I'm like, I remember, but I couldn't remember.
yeah, that's awesome.
well, you can almost look up anything. I just went to vertigo
Yep.
and microcurrent. It says how to resolve vertigo with microcurrent therapy.
That's
Wow,
awesome.
it is amazing
I'm
what
saying
you
it's
can
like this
Google.
thing is amazing, and just using what's out there already is going to be your what about, it's going to be that validation your client needs.
Yeah,
Right.
definitely. I have a lot of clients with like restless leg and a bunch of other issues that I'm definitely going to be sending them information for the Renew Spa, because I feel like that would help them a lot too.
Well, you know, Donna has had relief from her, restless.
Yes,
Donna,
she does it on
here.
her feet almost every night, and she doesn't have restless leg syndrome anymore.
That
Yeah,
is
I'm gonna
amazing.
add that.
That's awesome. Do you know how long it took her to get results?
Fairly quickly.
Yeah, I think it was
Cool.
just a couple treatments.
Yeah, it was fairly quickly.
Because I was thinking about one specific client I'm thinking about. She has had restless leg for about 3 or 4 years. And I was thinking about having her in for a demo and just doing it on her feet for her. And then, having her, see how it works. And then, because I've already sent her information, but she just hasn't gotten back to me. So,
It also helps with neuropathy. Diane
Yeah.
Stockberry's husband had neuropathy, and he's
That's the other
relief of
thing.
the pain.
Since it is a TENS unit, yes, it's going to it's going to do a lot for for nerves as well. Because like what they use TENS units for is pain, but they also use it to block out pain receptors and to rehabilitate nerve.
mhm.
And so
Yeah, if you Google that, it does
actually,
say that it helps.
it's doing a lot of that. The other thing is with cancer patients and lymphatic doctors, lymphatic clinics. The one thing I've learned, because I used to work with oncology aesthetics, is with oncology, if they have lymphedema, you have to keep the inflammation out.
Mhm.
They have to go for these massages, which cost a lot of money, right? But you really can't work on the lymphedema, right? But if you work this side, it affects this side.
Hmm.
And if you want to show those, this slideshow, if I'm able to share my screen, Joyce.
It wasn't letting me
Can you
share.
show that? Can you look at the presentation? You know, the inflammation pictures. Can you show those?
I can't get down to it. It's I'm very
Okay.
sorry.
Let me.
Oh wait. Can you see that?
Let me see. I don't see anything.
What do you guys see?
I
Nothing.
don't see anything.
Okay, I don't.
You want to make me host for a minute?
No, we already tried that. Hold
All
on,
right.
can you come back? Wait a second. Hmm. You guys there?
Yep.
Yep.
Mhm.
Maybe I could just email it to you. But I have the pictures for what I was telling you about the thermography.
Mhm.
You can see, if you look at it, you'll see that there's one side that I did that had all the inflammation. And after I did the treatment, it affected the whole face.
Wow.
So even though I didn't touch the opposite side, it still did. I wish we could show you those pictures.
Yeah, I'm very sorry.
Yeah, we did a facial spa demo, and Andrea, if you knew Andrea Kiesel, they had a thermography camera, and they were actually filming, showing it. So while we were doing the demo, you could see it going from red to green.
Wow.
You
It was
remember
crazy.
Andrea, don't you, Donna?
Yeah. So that's what I was trying to say, is like, you don't specifically need to work over the issue. You could work around the issue, or on the opposite side, it will still affect that.
Mhm.
Actually, where are you from? What city? Do you live in Des Moines?
North Carolina.
Oh, you're in North Carolina. You're not in Iowa at all. You're not in Kansas anymore.
I have a client who has last year she had a mastectomy on one side, and so she had her lymph nodes under her arms taken out, and so she was telling me that they have to be very careful about how, or like she can't fall on her arm, or like she has to be super careful now. Can she use the Renew Spa, since she does not have lymph in that underarm area, or the lymph glands in the underarm area?
It's for the arms, you said? What
Yeah,
side?
so she has it on the left side.
Okay.
I would ask the doctor on that one.
Not sure.
I would assume she could use it on her legs,
Oh, yeah.
I
but
mean, it's not going to be that one little area, but you're moving the lymph through the whole body, so it's going to go somewhere with there's ducts. So, and again, you're not having to work on that specific area. Like I said, think of that as the lymphedema. You can't work on that because of the lymphedema, so you work around it and away from it, but it's still going to affect it. It's just going to drain differently. That's all.
Okay.
I had to
Okay.
think.
That's good to know.
actually it's interesting because every doctor I've been to in the last, I don't know, since we came out with the Renew Spa, or since before we came out with the Renew Spa, I've asked them about, microcurrent and whatever ailment, disease, whatever they're treating. A lot of them don't know a lot about it, but nobody has had anything bad to say about microcurrent. Most of them all say, I've heard a lot of good things about microcurrent.
Yeah, that's why like.
Well, the
you
medical,
always-
the medical field out there is certainly supporting microcurrent.
And you always want to be on, like, as an example, I had a dentist. And the dentist, only wanted to use the facial spa on herself. Didn't want to do anything with her practice. Didn't want to know anything about the business. When she heard my presentation and I geared it towards TMJ and bone, she's like, I would have never thought to use it that way. And then she was interested. And I was armed with studies already that were out there for those specific things.
What is the bone? What is it?
It helps it helps to heal bone
Really?
growth. Yeah.
Well, because I guess it stimulates healing for all the tissues.
But if you do like if you look up TMJ or bone microcurrent, yeah.
Well, I wanted to add that my husband had a pacemaker put in January. And so we went to his adjustment and I took the Renew Spa with us, and they tested the Renew Spa while he was being calibrated, I guess is the word. And the doctor was like, no problems, he can use it.
Oh, that's good to know.
It's
Isn't
so
it?
non-invasive and it's so much less frequency than what they're trained on, but yet it has the same results. And that's kind of why the FDA pulled the spa from us, because I had it in 30 plus schools and in spas and salons, and we were selling them like crazy, and the results were amazing. And the FDA was just like, "What's going on?" So it just kind of stopped it all. But then it came back, going, "Okay, it's doing just." Because they were thinking it was like more medical based on the results, but we were getting the same kind of medical benefits that you were getting with those big machines, yet it's non-invasive. They brought it back to us as a non-invasive for cosmetic. That's why they're saying if you're trained in it, you can do what you want.
Okay, let's take one or two more questions. I want to be considerate of your time that you've all given us. Anything else?
Well, mine's not a question, but I just want to say thank you. I'm overjoyed with the love that I'm feeling for, the sharing that you're giving. So thank you. Thank you, everybody.
Yeah, thank you, Donna.
Yes.
Thank
very much.
you.
Hey, Donna,
Can we-
thank you again very much. Donna
Can
Beers,
we
we taped
second?
it, so you'll be able to listen to it. Okay, y'all go out and have a great day. Thank you, Donna, again.
Thank you.
Thank you, everyone.
Thank you.